New research suggests the death toll from South Sudan's 5-year civil war is far higher than suspected. A report funded by the US State Department has found that 200,000 people have died in the fighting since 2013. Adding in factors such as displacement, disruption to healthcare facilities and a lack of food, the death toll is at least 383,000. CGTN's Kate Fisher has more.
This study was commissioned by the US Institute for Peace in partnership with the State Department. It was conducted by a small team from the London School of Hygiene and Tropical Medicine. It concludes that around half of the deaths resulted from violence, with the rest caused by an increased risk of disease and reduced access to healthcare. The death toll, it estimates, far exceeds the figure of 50,000, which was approximated by the United Nations in March 2016. By comparison, the new estimate puts the death toll from the violence in South Sudan on a par with the impact of conflicts like the war in Syria, where upwards of 510,000 people are believed to have died in a significantly larger population. The findings were based on statistical models that compared actual deaths with expected deaths based on census projections and previously collected mortality data. The investigators say that the process was painstaking. Their research centred on 200 surveys conducted by humanitarian groups across the country, along with factors like food security and the intensity of armed conflict. Experts say an accurate death toll can be a critical tool for policymakers, and the absence of one for South Sudan has sanitised the horrors of the war and minimised its drastic effects. A US State Department official said the study helps to fill a gap in their knowledge about the scope of the war, and that having good numbers and seeing the human cost is important. While campaign groups say the huge number of deaths reinforces the need to hold the perpetrators responsible, accountable for their actions, and to increase international pressure on them. Kate Fisher, CGTN, Washington.